My name is Dr. Adam Davis. I'm a chiropractor who specializes in natural therapies and holistic medicine to get you healthier, happier, and lead a life without pain. I specialize in functional neurology, functional medicine, nutrition, weight loss, acupuncture, and applied kinesiology. And I have dedicated my life to learning from the greatest healers to help you achieve your highest potential in life. This is healing.
On October 10th, 2010, I was riding a motorcycle with my boyfriend and someone pulled out in front of us and we had to slam on the brakes. And I was wearing a helmet and so was my boyfriend, and I did have some goggles on, but this quick stopping caused my face to hit the back of his helmet and knocked me off, and I fell off. And I ended up face down in a pool of blood on the road, and my arm getting caught in the wheel broke my hand and pulled my arm out of the socket and crushed my humerus on the road, as well as the impact of my face hitting my boyfriend's helmet broke my cheek. They life flighted me to the nearest hospital, and I had surgery to try to reconstruct my humerus, and they ended up cutting my humerus bone off and leaving a few inches above my elbow, and put a titanium rod in my arm with a little ball on the end to go in my own socket. I didn't have any surgeries on my skull itself, but that impact caused one of the 97 bones in my eardrum to be crooked, and has caused some hearing deficit in my left ear, as well as some paralysis, with some may call a Bell's palsy, which is usually caused from a stroke, but I didn't have a stroke. At that time, 10 years ago, my face was sagging in a palsy fashion, and my eye still wasn't closing very well. I started having weekly acupuncture sessions for my face, which has helped the palsy be not quite as noticeable. And yes, it's been 10 years, but it's been worth it to continue to have monthly acupuncture sessions to keep my face.
Connie has a unique story with her traumatic brain injury from her motorcycle accident. One of the things that you can see with a traumatic brain injury is some motor signs and some weakness of facial muscles. One thing that you'll notice in her is that she has trouble closing her left eye. That comes from the cranial nerve 7 nuclei in the pons within the midbrain area, and the nerves come out and innervate the eye to close it. So as that's damaged, she's not able to close her eye completely. So therefore, a bead was installed within her eyelid, a weight to help keep her eye closed. Now she also has ringing in her left ear and some balance issues. This often happens when she gets adjusted. So one of the things we have to do is stimulate her facial nerves, which are presynaptic to her balance areas of her brain. So after we stimulate those nerves, when we adjust her, she doesn't get dizzy.
One of the things that we always want to start with the patient is make sure that the nervous system is working properly. One of the ways we can do that is test a muscle after we pinch it. It should weaken. If that doesn't occur, we know that the nervous system isn't working properly. Because Connie's had a traumatic brain injury, often this is where we start. 70% of the brain is supposed to inhibit the other 30%, but often after traumatic brain injury, this doesn't work properly. So we're going to assess her to see if autogenic inhibition, which is the muscle shutting off when it's pinched, is working properly. So we're going to start on this left side. Go ahead and bring this up. Hold your arm in, don't let me press. Okay, good, nice and strong. And then we're going to pinch the muscle, and it should weaken, but we'll see if it does or not. So we're just going to squeeze the pec major clavicular there, bring that up, hold tight again, and it doesn't. All right, so we know that the nervous system isn't working appropriately. All right, let's assess this side here. Hold your arm in, don't let me pull it out, hold tight, good. Drop that down, I'm just going to squeeze this side, hold tight. All right, so the right side of her body is working properly, but the left side is not. So what we're going to do, we're going to stimulate the left side of her body up in the, it's going to go into the midbrain, what we're going to do here, and we're going to see if that's going to make a difference. So one of the things that we can do is stimulate the trigeminal nerve just by rubbing over the face here. So we're just going to rub this area. That's going to send some input into the brain. And then we're going to check to see if that makes that work properly. Hold your arm in. And it does. All right, so we know by stimulating the trigeminal nerve, that's going to help improve her brain function. So that's one of the things that we're going to do with her. All right, so we're going to use this little device here that sends a little electric current in through her trigeminal nerve to help stimulate her brain. So I'm just going to put this on your face here. I just want you to give me a little feedback when you feel it. Okay?
Yes.
And we just bring the intensity up a little bit at a time.
Nothing, nothing, nothing. Now a little bit.
A little bit. Okay, and then I'll back it off a little bit. Still feel it?
Yes.
Okay. Perfect. All right. So, as we do this here, we're also going to stimulate an area of her brain called her parietal lobe, and we're going to do that by a technique called smooth pursuit. Okay, so she's just going to follow my finger here with her eyes. So we're going to have you start here, and then we're just going to come this way. Perfect, good. Now, doing multiple neurologic therapies at the same time has the biggest impact on neurologic function. So we're stimulating her trigeminal nerve here and her parietal lobe at the same time. We'll make one more pass here. Good. We're going to move this up to a different aspect. So we're hitting a couple different nerves in different levels of her trigeminal nuclei in her midbrain pons area. Do you feel that, or you need me to bring it?
Nothing,
Okay.
nothing. A little bit.
A little bit. Okay.
That's good.
Good right there.
Turn it down.
Down. Still feel it?
Better.
Good?
Yes.
Okay. All right. Can you explain what that feels like on your face?
It's a mini electrical shock that spreads out like that.
Perfect. And again, just let me know if that becomes too much.
And even though the setting is the same, as time goes on, it becomes stronger, as my nerve
Yeah.
is feeling it.
Yep, as it kicks in. Good. Excellent. We'll do it on this lower aspect here in the jaw. So again, just let me know.
Okay.
Good?
More.
More? Okay.
Okay.
Good. All right. Knowing that this is going to improve her motor function, it's going to improve the quality of the adjustment. Adjusting her without doing this technique first often puts bad input into the sensory system of the brain, and we don't get as good of quality of treatment. Good, okay, perfect. Now we're going to go through the ankle adjustment. Okay? And we're going to want to stimulate the left side, so we're going to do a lot of left side adjusting. So here we're going to start at the base of the skull. All right, we're going to bring the head to the side here. Really easy there. Good. Often her ear will kind of feel full, and sometimes after we adjust it, it'll kind of release and relax.
Mm-hmm.
Do the same thing here. Good.
It wasn't super full, but I definitely felt a release on that side.
On that side when we do that, yep, very good. All right, so we're gonna check again here just to see if the autogenic inhibition is still working or if it's kind of run its course. So I'm just gonna squeeze her again, bring this up, hold tight. All right, so now that that has stopped working again, one of the things that we do with her therapy that continues to improve her nervous system and get her adjustment to hold is called biofeedback. So we're going to do that now. Now, the biofeedback machine that we use is called the Clear Mind Focus. What this does, it helps balance brainwave patterns. Okay, and again, we can do muscle testing to see which program is specific for her. So there's different protocols that we can use. So I'm going to show you how not getting the right protocol is not going to make a difference. Okay, so here's 104. Okay, so we're just going to hit that, play, and it counts down. Now what this is going to do, it's going to have lights that go off in the glasses and sound that gets activated within the headphones. See that? Can you hear that? Yeah.
Yes.
Okay. All right. So that's stimulating her brain in different brain waves. Now, if that's the proper protocol for her, then that autogenic inhibition will work correctly. So we can test to see if that occurs. Okay, go bring it up. Hold tight. And it doesn't. Therefore, we know that that's not her correct protocol. Now, because we've done this with her before, I know that her correct protocol is 109, which is, I'm going to put that on her right now. These therapies usually last for about 30 to 40 minutes, but that helps stimulate the brain to get the nervous system to work better. Now this is the protocol we use on her, so we're going to check if autogenic inhibition works properly. Hold tight. And it does. So we know that we're activating the area of her brain that causes the proper inhibition and proper motor output response. So this is the therapy we're going to do with her. One of the things that we did with Connie is stimulated her trigeminal nerve with the little sensory device that we use to activate her nerves. So the trigeminal nerve comes in here in the area of her midbrain called the pons. That's where cranial nerve 5 comes in. Now, the other things that we did with her was the biofeedback, which uses the optic nerve through the light stimulation, which runs into the back of the cortex in area 17, it's part of the visual cortex, and also hearing, which is the vestibulocochlear nerve. Okay, the cochlear nerve is the one that does the aspect of sound, and that fires in to this area between the pons and the medulla called the pontomedullary area. One of the things that's important about that is that's an area that helps inhibit and reduce motor activity. That's why it helps with balancing her muscles.
After a year or so after the accident, I had known that acupuncture had been a help for me in the past with a previous condition a long time ago. So I came to see Dr. Davis, and he and another acupuncture associate of his I started having weekly acupuncture sessions for my face, which has helped the palsy be not quite as noticeable. And yes, it's been 10 years, but it's been worth it to continue to have monthly acupuncture sessions to keep my face. And it also helps with other dietitian conditions that I have too.